we have in the US 2.7 million infections and almost 130,000 deaths at the moment from this disease. In between that, we have people who survive. They don't die from the illness, but they do have serious leftover lingering issues, including seriously scarred lungs, strokes, heart issues. So this certainly, while many people do get over it, there's definitely a significant number of people who are dying and who have trouble. Like I have a friend from college, he got coronavirus and it's been 3 months and he still has trouble with shortness of breath and energy and breathing. So definitely take this seriously. Obviously, if you don't want to get infected, that's the much better route, because you're really rolling the dice in terms of what happens after you get infected. And my friend, for example, is perfectly healthy, no underlying conditions. He's 44 and it happened that way. So it doesn't just hit people who have a weak immune system who are a high risk group. Certainly that makes your chances worse if you are in the high risk group, you've got low immunity. Okay, so number one thing about this illness is this virus is prevention. So if you don't need to hang out in big crowds, busy bars or gyms, I highly recommend you don't. Right now, it's still the best thing is if you do social distancing. Best thing is social distancing plus masks if you're going to be out anywhere. Obviously, you don't have to wear a mask if you're driving alone in your car, if you're in your house, if you're in a place where you're isolated and you don't see many people. So this advice really only applies for people who are in the cities, who are in more densely populated areas. If you're in a place where there's no infections, if you're in Iceland, they basically address that issue completely. So they're pretty much back to normal. So there are countries where they've resolved the coronavirus. It's well under control. Iceland's one, Hong Kong's another, New Zealand, Australia, places like Thailand and Vietnam. Their infection numbers are very low and their rate of deaths are very low. So I'm very glad my mom's in Hong Kong right now since the beginning, and they're right next to China. So they've had 1,200 infections and 4 deaths. So that's much less than what's happening here in the US, where we have trouble even wearing masks. So masks is definitely, for some people an inconvenience. It's not something that we're used to, but if we're looking at the world and what has helped, masks definitely are helping. I know that there's some detractors. There's people who say, well, if you don't wear it right, you get infected, or if you have problems with your lungs, it's gonna cause you problems with breathing. Certainly, you don't want to. Again, that's why you don't want to go out if you don't need to. But there's a lot of different kinds of masks, and we find that you don't have to wear the super strong, the N95 mask in order to be protected. We found that, cloth masks with surgical masks, you're gonna get many of the benefits. So I'm gonna pull up some photos here so you kind of see what some of the data is around it. All right. Okay, so this is I don't necessarily go by these percentage numbers, but I do go by the principles here in terms of the masks. So, the masks help more if you have a basic mask, whether it's a cloth mask or surgical mask. It doesn't protect you as much as it does protect other people. So the principle, the idea around it is that everyone's wearing masks, then everyone's protecting other people, and you're going to drive the numbers down. So that's what's happening in some of these countries where it's been really successful. In addition to that, obviously they do contact tracing, which we don't do here, we haven't done here. So you can see here with the coronavirus, if you're wearing a mask, you still have a 70% chance. I don't go by these numbers exactly, okay? But you can see how, like, if the person who's infected is wearing a mask, because what's happening is that basically what we're finding right now is the transmission is primarily by air, through droplets, and you're producing droplets when you're talking, like I'm talking right now, when you're breathing, especially if you're heavy breathing, like you're exercising, you're producing a lot of these droplets, and they don't immediately fall to the ground, and they go beyond 6 feet. So if you're sitting in a restaurant, an enclosed space, those droplets just go everywhere because you're probably not wearing a mask because you need to eat, you need to drink in the enclosed space, and usually there's not enough of a adequate circulation or ventilation in there. So that air is just being moved around, and it's very easy to get infected. So but if you wear a mask, then that transmission goes down because those droplets are going to hit your mask before they hit anywhere outside. And then if everyone's wearing a mask, then your percentage even significantly down. But you can see how, because we also don't know who's infected and who's not, most of this is asymptomatic, or you don't know for a week or 2 weeks after you get infected that symptoms show up. So this is why it's important from a public health standpoint to wear a mask. And really, I find it's a tiny bit of inconvenience we have to look at the bigger picture of, if we want to really fully reopen, if we want to resume our lives, we need to kick this virus out. And the only way to do it is if we can control it. And we know that other countries have been able to do so. And we just need to follow and learn from some of these places where they have been able to control this. We're kind of on the other end of going out of control here. And this is going to impact our economy even more. It's right now causing more shutdowns. People are pausing reopening. And this is even before the second wave is hitting in the fall. So we have to learn from history that there's probably going to be a second wave, and there's going to be another series of closures. But if we're able to control it right now, then we can avoid that second wave. So here's some of the percentages that we looked at before with the mask. So we can see, obviously, the N95 mask, the P100 mask. These masks do really well. But if you wear just like a simple surgical mask, your percentage is still up there, 63%. And here, this is against micron particles. So the virus itself is about 0.1 micron. But it can still, even though that's the case, a lot of these things are able to filter it out. So everything from dish towels to t-shirts to surgical masks, most of us have access to these items, okay? But because we have people who aren't wearing masks, it is I do emphasize trying to find a mask that better protects you, not just the other person. Ideally both. Okay, but you want a mask that also protects you. The surgical mask is not fully fitted around your face. You want one that can fit around the face so that when you breathe in and breathe out, it goes through your mask and not the outside air. So I have one here which does that. Okay, so this one, and there's a metal strip here that contours around your nose. So you can see as I breathe that it goes in, so you can tell that it's working. And you can feel if there's any air coming out from the side, and I don't feel it right now. And you can see that going inhale and exhale, this thing deflates and inflates. So you know that it's working. It's filtering the air that I'm breathing through the mask and not through the gaps. Okay, so that's one important thing about having a good mask to help protect you. So these you can get online. there's a place out of Taiwan, and Taiwan's one of the places that has controlled this virus. And there's a place that sells it online that you can get these masks, and it's called happymask.co. So it's not .com, but it's .co. Happymask.co. So these masks, they are reusable. What it means is that they are washable up to 50 times, and you can wash these by putting them in water with a tiny bit of detergent and then air dry them. Okay. So these are 3 layers. It has a layer inside that's the filter. So this really can help you with protecting yourself here. These are, I think, $18. So they seem very expensive, but because they're reusable, it saves you money over time. And with disposal masks, they're meant to be used once and then you throw them away. Even with these, you don't want to use these every day. I personally I cycle through about 4 masks, so that each day each mask gets rest of 3 days, because the idea is that if there is any virus that gets caught in the filter itself, you don't want to reuse it because you're going to expose yourself to an infected mask. So you use it, you come home, you can put it in a paper bag, air it, let it dry out over 3 days. Any virus on it will be deactivated, and then you can reuse it again. If you want to wash it at that point, you're welcome to wash it too. So that's what's good about these masks and about this way of cycling through the mask. Okay, so that's one thing. If you don't, there's neck gaiters that you can use, but these aren't as effective. These are more about protecting other people. But these breathe very well. And there's a lot of different designs, so you can look cool doing it. You can do bandanas, all right? But again, these are good about catching your air droplets, but not as much of breathing in other people's stuff. So I do recommend some of these masks, and obviously if you have access to, this is more the heavy duty stuff, you have a half-face respirator with an air filter. This is a P95 air filter that I have added onto this mask, and I use this at work. And this is probably as protected as you're gonna get. So this one seals around, and these are reusable, so you can clean the whole thing afterwards. For most of you, you don't need this because you're not in clinic, you're not seeing patients. So if you're just going to the store, you're minding your own business, you're not hanging out in a bar, this is the way to go. The normal face mask, the way, you don't need this. This is probably overkill, unless you're in the office and you're seeing people day and night. So that's kind of where we're at with these face masks. So these, they say, is rated for equivalent of an N99. I don't trust that as much, okay, but these are definitely more effective than the rectangular mask that has a lot of gaps that don't really fit you adequately. And they actually make these in 3 sizes, a small, medium, and large, so you can get one that fits your face. Most people, medium's gonna work. A small is quite small, so it's more for like kids or if you have a really small face, and then large if you tend to have a larger face. So, but for most people, my wife and I included, we wear a medium. So they also have, if you want fun, so you don't have to get this boring color like me, okay, there's other colors. There's like this Hawaiian camo color. There's a cheetah print. So they have kind of designer options for you out there. And they have adjustable ear straps. I don't like ear straps as much because I wear these for all day and they're not that comfortable. But what you can do if you do that is you can tie the ends and the back so that they're not using your ears to hold it in place. And actually this way you can get a tighter fit around your face as well, so that it's more of a seal, okay? All right, so that's kind of face mask for you today. Anyone have any questions at all? All right. So I hope, oh, I think there might be some questions. Oh, website for that mask. So I'm going to type it into the chat so you guys have it. So I've been recommending people to this site, and they actually ship out of Santa Monica. So they're pretty close by. Usually you get them in a few days if you order it, and if you live in LA. Again, I don't fully trust anyone because there's a lot of fake masks out there just because they say it's, especially if it's not a 3M, if it's not from a reputable place, if you're buying it from eBay or Amazon or a friend of yours or Facebook, you can't trust that it is truly like I have this mask that says KN95, okay? So KN95 is this Chinese standard. So you have to understand how this works. N95 is kind of what we hear about a lot. What that means is that it filters out 95%, or it's rated to filter out 95% of particulates that are 0.3 microns or larger, okay? So that's kind of the standard that we're looking at. So you may also see like N99 and 100. That means they filter out 99%. 100 means 99.97% of the same size particles, those 0.3 micron particles. But they're effective against coronavirus, even though coronavirus is smaller than that. They are fully effective against those things. So, and if you're just using it casually, those will be a safe bet. But the problem is that there's a lot of fake masks out there because everyone's in a rush to make a lot of money off of fake masks. A lot of these are coming out from China. So I don't spend a lot of money using these. One way you can test your mask, whatever you're using, okay, at home, if you have a vacuum cleaner, what I do is you can use cornstarch. All right, so I don't have the official box of cornstarch, but this is my cornstarch. This is the way I keep the moisture out. But cornstarch is smaller than 1 micron. It may not be an absolute comparison. And the reason why it works against coronavirus is even though the virus itself is 0.1 micron, it's usually transmitted through our droplets. So our droplets are bigger than 0.1 micron. That's why it's quite effective if you wear a mask. So even if the math doesn't seem right, your droplets are bigger, and that's why it's able to catch it much more readily. Okay, so anyway, back to cornstarch. So cornstarch is less than 1 micron in size. So if you take your mask, okay, and what I would do is I would put so you would take your mask and you would take like a dark cloth, a contrast, so because cornstarch is white. So basically you would know if it goes through the mask and onto this, then you would see some white material on there. So you put this with a vacuum cleaner in the back. So your vacuum cleaner, the suction part, you put it in for here, and you have some cornstarch you can lay down on a counter or a plate, and then you try to vacuum it up. And you'll see that it will suck up onto the mask, and this mask in particular, it won't go through. So if you have other masks, that's one way you can sort of get an idea of how good the filtering is on the mask. It's not 100% scientific or for sure, but it gives you a relative idea. And if you try it with, for example, a sock or a t-shirt, it'll easily go through and you'll get the cornstarch on the material on the back. But if you use something like this mask, it won't go through, it'll filter it out. And at least that'll give you some relative sense of safety in terms of if you're not sure about the mask that you have and how effective it may be. But at the end of the day, still, even if the best mask, avoidance is the best thing. So I definitely would avoid anything, especially indoor gatherings. You're much safer outdoors in the open air where there's circulation and where, you know, droplets get diffused really quickly. But if you're inside, all bets are off. So that's why bars and gyms are really dangerous right now because people are breathing heavily. There's a lot of droplets going around. And that's the main transmission method right now. I mean, you still want to wash your hands, and you want to be careful about what you're bringing into the house. But the main method of transmission right now is through the air. So if we are able to collectively control that and reduce these numbers, you know, I'm hoping that we don't have to go through some major shutdowns, which we're inevitably going to do. Okay, question from Dottie about plastic shield masks. So yes, you may see some people wearing shield masks, kind of this clear shield around the face. It works through direct, like if someone sneezes directly at you, it's going to protect you. Because, you know, aside from breathing it in, our eyes can also be exposed to this virus. So that's another way that it can come into you, is not just through your nose and your mouth, but through your eyes. So the plastic shield does help with, again, that direct transmission. So if someone's talking in front of you, like I'm talking right now, so I'm generating a lot of droplets that are just coming directly at you. So the face shield helps that, but that's more if you have those kinds of interactions. And that's why they put up those plastic, you know, clear shields at the cash registers now. So it blocks that. However, if you're indoors and the droplets concentration goes up because there's lack of circulation, it's just gonna go around those barriers, and if you're unprotected, you're gonna breathe those in. So face masks do serve a purpose. And yeah, I see people wearing them, and I think, but you still wanna have, number one is the face mask first. If you wanna do the shield, that's optional. Again, that's depending on where you're gonna go and where you're gonna be. If you're a healthcare provider, I do recommend something like that, or have some safety goggles instead of the shield. So I hope that answers your question. Anybody else with questions? I know it's a lot, but it's a little bit of inconvenience, but it works in other countries along with other strategies. We just failed on many different levels in our country to control this, and now we're playing basically mitigation, which is not a good game to play, because it's just, there's a lot of infections out there, and there's also a lot of resistance for one reason or another to helping control this virus. Some people think it's not real. Other people think masks don't help. They do help. I mean, obviously it's not the end all and be all, but it does, you know, seriously curtail the risk of airborne transmission. And anything that we can do to curtail this, the more that we're going to be able to get back to some semblance of our former lives, and not be trapped indoors. So right now, like LA County is shutting down beaches and sidewalks and things like that by the beach for the July 4th weekend. Now, if we all did our work, and I know most of you in my group have, but unfortunately there's a lot of people who don't want to wear a mask, don't think it's necessary for them. But at the end of the day, if they really want to enjoy the outdoors, they want to go back to restaurants and gyms, we all need to do our part to get this down. But that's the frustrating, and it's sad. It's sad because it's totally controllable. It's our choice. We see it done in other countries. And so most of us don't read the news outside of this country, but in the world, there's a lot of places where there's success. And so we want to have that perspective. It's not just the US against the virus. It's, you know. Anyway, that's my spiel. Thank you for joining us today. If you have any other questions, please follow up with me directly, and I can help you. All right. Thanks a lot.